Hi, I'm Michelle G. Rogers, and today you are going to learn how to foam roll your IT band. The IT band is a shortened way to say iliotibial band, okay? This is a really thick band of tissue that connects your glute down past your knee. And all of that connective tissue, fascia, is pretty much throughout your entire body. So this is what we're doing with the foam roller. We're teaching that fascia to release a little bit and let the rest of your muscles work well together. So when we isolate one area of your body with the foam roller, you're actually freeing up other tissue. This fascia connects all the way down to your ankle. So you might feel things sort of shoot down your leg when you start foam rolling for the first time in this area especially. So you're going to take your foam roll if you're first starting out. As you get more and more used to foam rolling, you'll find that you're not experiencing as much pain anymore, and you might feel like you're not getting as much out of it. That's not exactly true, but some of us like to feel a little bit more of the intensity, and that's when we kind of move into the harder surface or even more dense foam rolls that you're absolutely welcome to buy once you sort of wear out one of your new ones. So we're going to start easy. This one has a lot more give than obviously a PVC pipe will. So the easiest way to get started is to sit sideways like this and have this foam roll right up against your body, sort of parallel to your thigh. And then you're going to lift yourself up and straighten out that bottom leg. You want this foam roll to go under your bone here. This is where your joint begins. You don't want to roll over joints. That's when you come into a little bit more pain that you don't want to experience. So we want to be on the soft tissue only. And then you can just lower yourself down into this sort of side plank position. Since you are in side plank, this is work all by itself. So you might, have some fatigue in your shoulder, or you might get, a little, saggy in the middle. So try to really engage your belly and use your other leg up front here to control the motion. So right here, the connective tissue is a pretty thick band here. So you might start sort of flat on your side, but you can, roll slightly forward and slightly backward, looking for your adhesions, okay? So you'll just stay that very first spot there for about 30 seconds. This is not the most tender spot you're going to find, so I'll warn you ahead of time. Once you sort of feel that release a little bit, you move down the leg by pushing yourself away from the foam. And then you find your next spot, and again, you're just feeling around, but try to be still when you find the most tender spot. Alternatively, if you think you can handle it, we can also take that area through a range of motion by bending that bottom leg and then squeezing the knee straight. So you're going to stretch the area and then engage it, sort of creating a little bit more tension and relaxation through the muscle spindles, and that'll help sort of release it a little more quickly. However, it will be a little more painful. So just do those things when you're ready. This could be enough, okay? And then you move to your next spot, and you're looking for that tenderness, and when you find it, just try to breathe through it. Use your mind to tell your body to relax. This is a tool, but your body is really the one in control. So listen to it, pay attention to what you're feeling, find out if there's any tension anyplace else. We tend to, tense up when we're feeling some discomfort, so just be mindful of what your hands are doing, what your face is doing, and try to relax. And then take it to the next spot. Now, I often find a nice little flippy spot somewhere in the middle. That's where the thick band of connective tissue is connecting to this vastus lateralis muscle, the outside of your quad. So usually where the thicker connective tissue is connecting to muscle is where you're going to find the most gunk. So work through it a little bit, and you're going to basically try to get all the way down towards your knee. And usually around there is where you don't feel as much. And you can do another sweep, go all the way back up to the top. And if you want to roll forward and backward, you don't need to spend more than 30 seconds per spot, and then you'll switch sides. Okay? We'll do that real quick. And this time I'm going to show you how you use maybe something a little bit more dense. I've got it wrapped in a small towel. The thicker the towel, obviously, the more help you're going to have. And again, you're a little closer to the ground with this one, and it's a lot more painful because it is a lot more solid, and you'll feel a little bit more that's going on. Now, I'll work on my way all the way down. This is my worst leg, so I usually have a lot more. You can probably see it flip certain spots there. So that's the spot I try to sit with, the one that hurts the most. Okay, and the first time you do this, you might have to figure out where that is. And good. So that's not so hard, right? Unless you're not really quite in an active state of mind right now. So if you have a hard time holding yourself up on your side, that's where the rolling pin comes in handy. So if you really can't stay on top of a foam roll or hold yourself up too long, you can use a rolling pin to sort of use your body force against it. It's not going to be quite as effective and you have to work harder with your upper body, but at least you'll be able to hit that when maybe your shoulders may be a little wonky or maybe you're a little heavier and you can't hold your body weight up on your side. So this will work just fine. They also have something that you can buy in a store online. It's called the Stick, and it's sort of, I think, modeled after a rolling pin, so you don't really need to buy this, but it does have sort of little beads along the middle and handles, and that'll help sort of roll out your tissue as well. So that is how we roll out our IT band.